think that, you know, that's why I think that these moments of ethical tension, that list of 101 things, they're not a problem. That's like going to the gym. When these things happen, you suddenly have a chance to be able to work some muscles, and
Right.
I come at this from a specific theoretical model, and I thought I didn't really have a chance to talk about this in the talk, but
Okay.
different models, like if you come from, say, something from a cognitive behavioral model, it's often skills based. And so there's a clear sense of the work that we're doing is to reduce symptoms through the learning of some specific skills.
Right.
Let's say,
Teaching and training,
yeah,
step by step.
so often the CBT therapist can, especially first wave CBT folks, we're at a position of expert. I'm the expert in the room. I have I've learned this, and
I'm
we're going.
having a
Yeah.
Albert Ellis flashback now. So
Yes.
we had talked
Yeah.
about him earlier in another session. Yeah.
Al Ellis is he's a good example. And again, there's potentially something wrong with that because, and my worry would be, and my earlier training was in behaviorism, so I was trained to do, I did contingent reinforcement stuff with the patients and inpatients in psychiatric hospitals, and
Yeah.
so I that was my initial training, and I worked with some famous behaviorists or two, and learned some things. But when I started doing actual therapy, life was more complicated.